Hi, I'm Corinne Kyriacou. I'm an associate professor and the director of the Master of Public Health program here at HOFSTRA. So National Public Health Week is a nationwide event to help raise awareness about really important public health issues, to celebrate some of the achievements in public health, to highlight and spotlight some of the challenges. And so it's really important for us as a relatively new public health program to help the community understand what's going on in the public health arena, what are some of the successes we've had, where do we need to focus our efforts. It really is an opportunity for us to show our students what is it like to be a public health professional on the ground. Students at the undergraduate level who, first learn about public health and like, oh, I've been looking for how do I work in the healthcare field, but outside of medicine, or how do I work in the healthcare field where I can have an impact on policy, at a higher level, or how do I work in the healthcare field where I can really be tackling, social justice issues. So from an undergraduate perspective, that light bulb happens often. But even at the graduate level, even for students who have been accepted into the MPH program and have a basic understanding of public health and know that they really want to work perhaps in an area of research or education or advocacy, and then find their particular niche while here, that happens often too. And they'll say because they were participating in something like National Public Health Week, or because they're serving as a technical assistant for one of our community partners, or because they're doing their internship or their required research project, that they say, this is really what I want to do. I didn't realize that this is also something that public health lends itself to. So there have been a number of different things that have motivated me to work, particularly looking at ways to improve care and services for those with chronic illnesses. I think from a very young age, I was interested in that whole aging process. I was very interested in watching the progression and being involved and serving as an advocate for my own grandparents. And I really had a lot of different examples of what aging looks like. It was always curious to me, how do we support individuals who are facing these kind of challenges, and not just the individual themselves, but the family and the social support systems. And then that led me to think about, well, what policies and programs do we have in place that are supportive and represent all the different kinds of things and directions that somebody who's aging with a chronic illness could face. So that was kind of the early momentum. And then when I learned about public health and the efforts there, I really saw this as a social justice challenge. I like to think of public health as the glue that kind of brings everybody together.